The Differently Brained team acknowledge the traditional custodians of the lands on which we record, edit, and stream this podcast. We pay our respects to all First Nations peoples and their elders past, present, and emerging. We extend that respect to all First Nations cultures and their ongoing connection to the lands, waterways, and communities. Let's get into it. Hello and welcome to Differently Brained, the podcast where no brain is the same. I'm Jacinta Dietrich.
And I am Lachlan Rutherford. And we're back again with another stellar episode for you. And we've got a guest. Our guest today is Dr. Romi Fried. She is an ADHD dentist in Melbourne who's dreaming of a future where neurodivergent folk can feel safe and affirmed in the dental chair. Until then, it's been her mission to speak about accessibility wherever she can and to provide free and accessible oral health education and to arrange training for oral health clinicians in how to be more neuro-affirming. Romi, it's a pleasure to have you here today. Thank you for coming on.
Thank you. What an awesome introduction.
It's almost as if I took it straight from your website. So just to begin with, this is kind of a broad question. What's it like? What does it mean to be an ADHDer to you? What does it look like for you day to day on the neurodiverse pie chart?
Oh, yeah. When I think about the pie chart, I actually think about the one that Sunny Jane Wise did. That's the lived experience educator on Instagram, which is reframing the kind of classical pie chart of deficits and disability into support needs and strengths.
Mm-hmm.
And that's kind of what being an ADHDer to me at the moment is really about, accepting what it is to me. Like, for so long being in this old paradigm where it feels like there's something wrong with you. It's not a nice way to live. And so now it kind of means liberation for me. I'm really unmasking more and accepting that this is who I am after so many years of trying to fit in and be more neurotypical. But yeah, as far as I can remember, I've really known that my brain works differently to other people. I was having existential thoughts before I could read and write. And yeah, I was constantly asking questions, endlessly curious about anything and everything. I loved learning and I saw tiny details that other people didn't seem to. At times, it felt really magical. I had this kind of superpower that was really special to me. And when I spoke about concepts in my mind and connections between ideas, I noticed that other people didn't really understand or relate to it. And adults thought I was too grown up for my age.
Yeah.
They called me precocious a lot. I learned pretty early that the whole superpower thing needed to be filtered and diluted very heavily if I wanted to fit in. So that applied to everything: my words, my ideas, my body language, the way I express myself creatively, my tone, even like my reactions. Like if I got a fright, like even that was masked.
Right.
Everything was being filtered. I put a lot of energy into the mask. I actually have a mask tattooed on me. So with regards to being an ADHDer, it's confusing the more I unmask because it's so contradictory.
Yeah.
I used to, in school, I used to understand the autistic kids. Like I just got them and I understood their minds and their behaviors made so much sense to me. I did not understand how the teachers couldn't see it.
Yeah.
Like it was so obvious. But at the same time, I didn't relate fully because I also had a chaos demon living in me, which was my ADHD.
A chaos demon. I love that so much. Yes. Excellent. Yes. As a fellow chaos demon haver, nurturer, I guess. Amazing. I'm using that.
Yeah. So it was, those moments where I was suddenly very impulsive and disorganized, which was very dysregulating to my AUT friends. And there I was again, not really fitting in. So even when I made friends with the other chaos demons, who later became ADHDers, I felt like I was too sensible and rigid and anxious and sensitive to sensory things. So it was very confusing, lots of contradiction. I'm using very simplified examples of the complex neurotypes, but at the time I was very desperately trying to understand it all. And these were the patterns that I was observing.
Mm-hmm.
So There are a lot of moments in my journey as a differently brained human, but the most pivotal moment of realizing what an ADHD means to me is when I met my friend Darcy. I'd met her already. We went to school together, but we didn't really cross paths much. With hindsight, that was because I was masking so heavily and Darcy was pretty much raw dogging life, unmasked.
Wow.
Very authentic. So we didn't have a lot in common at the time. But when I moved out of home, I needed a housemate. Darcy needed a room. And it was jaw-dropping for me. Like, Darcy was so freely expressing themselves in all the ways that I had been actively suppressing. And so many little quirks and behaviors in myself that I had been policing as weird and rude and unacceptable. And Darcy was just existing in them beautifully. It was like my whole world got turned on its axis.
Yeah.
And I started letting the real me out little by little. It felt incredible.
Oh.
And I was finally just in this environment where someone got me and I didn't have to explain it. And we used to joke about being brain twins before we both got our diagnosis. And yeah, I'd never been understood like that before by anyone. So they're still one of my favorite people in the whole universe. And they've really informed what my day-to-day life looks like as an ADHDer because I'm not policing everything as much.
Yeah.
So yeah, some days I'm very autism forward and other days very ADHD forward. And most days it's a bit of a mix. But it's probably best described as contradictory and confusing. There's no day that is the same.
How have you gone unmasking? So for me, like, I don't notice until people have started pointing out, like, oh, you let this out now, or oh, you do this now kind of thing. And then I'm like, oh, that would have been a thing that I would have masked a lot, like stimming, and I cry a lot more now and stuff like that. How do you go actively trying to unmask kind of thing? What's the process there? Help me.
It's definitely a process. It's been a few years of this process for me now, so I have a different perspective on it than when I first started.
Yeah.
At first, it was just kind of oscillating between being around a bunch of neurodivergent people and being like, oh my God, I have permission to be myself. Of course, this is me. This is who I've been all along. But then going back into the very masked neurotypical life that I'd built for myself and being so good at masking that I'd be like, no, maybe I'm just indulging myself. Maybe I'm just, making it up.
Yeah.
So it's this constant battle between like which me is the real me. But ultimately it was just like which one takes less energy.
Yeah.
And I find most of the unmasking, it's actually not trying to unmask. It's kind of just letting go of the reins.
I love that. Okay.
That's actually, I wanted to ask the both of you this, just based on what you said, Romi. Is it like a struggle maybe before getting a diagnosis, trying to figure out whether or not I'm trying to choose my words properly right now, whether you're being authentic, whether that's the real you or whether it's something else that is, that you're putting on, so to speak. Is that something that is kind of like an existential dread thing that happens for people who have autism?
Yeah, I think it's pretty common to get very existential with it. And with masking, I think for some people it's more conscious, but for everyone it seems to me, from what I understand, that it's kind of just for survival. It's like you have enough moments where you're ostracized or punished or disparaged for doing something that felt really normal to you that you just kind of catch on that it's easier to do it this other way. It's very confusing then though when you're around, like when I'm around other ADHDers, I have to like change gears and be like, oh, it's fine. It's actually fine.
It sounds so exhausting as well of a thing to have to switch between these.
It's the main moment where I think of the phrase fake it till you make it, and it is not helpful. Like I get it in terms of self-confidence and all those other things, but in terms of, being neurodivergent, I think the fake it till you make it is essentially what masking is, except we're never going to make it. Like, that's not the
Yeah.
mold that we're in. I think, you know, I've been very, very lucky in terms of I've always lived with people who have really understood. Like, I live with my boyfriend now. I lived with my sister and her partner before that, will be husband by the time this comes out. Oh my God. And so I've always had that kind of outlet at home, and I haven't been in a work office for like 4 or 5 years now. So I think I maybe
Congrats.
forget. Thank you. I think maybe I forget that, you know, I probably don't mask as often as I used to, simply because I'm not in environments where I have to. And that's going to be a real bloody shock when I go back to work, I reckon.
Yeah. Oh, that's amazing, because I did not really have that escape at home. Like,
Yeah.
don't get me wrong, it's hereditary, and there's definitely a lot of neurodivergence in my house, but everyone was masked. Like,
yeah.
I was taught to mask growing up by my parents, and that's what they were doing to survive. So yeah, it's weird masking full time.
Yeah.
And then as an adult, I was like, oh my God, there's another way.
I don't have to do this all the time.
Yeah, it's very disorienting. It's still weird for me. Like, it's still weird to kind of sit with the acceptance that, like, oh, I can just be myself full time. Like, that's an option.
Yeah. So you were talking earlier about, you know, how you were always described as very precocious and smart and on top of things and everything. Did you always want to be a dentist?
No. When I think back to like young Romi, she was, and still is, very curious, wanting to understand how everything works. And her special interests at the time were medical TV shows, so like House MD, Grey's Anatomy,
Nice.
Scrubs.
I'm currently going back through House because I realized I never watched it all the way from start to finish. So now, you know, I'm learning a lot. It's almost never vasculitis. There you go.
Interesting. Yeah, I definitely wanted to be a doctor as a result of House. I don't think I can rewatch it. I was so obsessed. Like, I could recite every episode. And now I'm like, no, I actually can't. I can't go back there.
Fair enough.
But yeah, I really liked the idea of medicine, but alas, ADHD, impatience.
Yeah.
The idea of having to maintain like near perfect grades and also study for what looks like now, it's about 10 to 15 years before you really start working as a doctor and making any money. And I just knew I couldn't sit still for that long. So also my chaos demon was impacting my grades a little bit at that point.
Yeah.
But yeah, anyway, I had a few family friends in the dentistry world, and I started getting curious about it. I liked the idea of still being able to do medical things, very hands-on, lots of problem solving, lots of attention to detail and helping people, and also having a bit more of a work-life balance than doctors typically do.
Okay.
It's funny that that's actually what attracted me the most, the work-life balance, but that is not dental school. Anyway, I ended up getting a job as a dental nurse, and I loved the fast-paced environment. It was very stimulating for my ADHD brain.
Yeah.
So back in, like, I think it was 2017, I applied for dental school, and I've been in the dental world ever since.
Okay.
How long does dental school go for?
It's, I think undergrad is 5 years, but I did postgrad. So it's 4 years postgrad plus the undergrad degree is 3 or 4 years.
Far out.
Yeah.
Yeah, okay. It's still a solid chunk of time.
A lot of time. I got 2 gap years in there as well.
Oh, nice.
Oh, well done you.
Aside from the fast-paced nature of dentistry and the work-life balance, is there something that kind of differentiates itself from other medical practices that might be a bit more, I guess, conducive to having a what was the term you used? The demon thing? Oh my god, my
Chaos demon.
Chaos demon.
Okay, let me start again.
Yeah, I mean, now that you mention it,
Yep.
I think one of the things that attracted me probably was that it's often like a crisis to deal with.
Yeah,
you know,
right.
someone comes in with, it's more like being in an emergency room where you have someone coming in with a problem and you've got to kind of diagnose it and get them out of pain and manage it all in the 1 hour. And you're dealing with people who have high levels of anxiety as well. It's definitely very stimulating.
Right.
I have a probably rude question, but it's the thing that my brain goes to every single time I think about dentistry and stuff. I have braces, so I'm pretty familiar with all my dentists and things like that. Isn't it gross?
It can be. It can be. When I first started in the dental world, I was still masking so heavily. Like I had so much to prove to myself and everyone else that I didn't want to be squeamish or delicate. I wanted to prove that I was like house. And by that point, I was so dedicated to masking that I really had perfected the art of disconnecting from my body. So it was like I walked into the clinic, I took this elevator up into my head and cut the cords from like my sense of smell, like all the body signs that are alarm bells of being overstimulated. I just was like, nah, not going to deal with that. And I hyper-focused on being successful in that environment.
Yeah.
It was like whatever it took, I would do it. There were definitely moments where sensory overload was setting in and bubbling up, and I just kind of wrote it off as me being weak and forced myself into more of it. I thought I might eventually like desensitize myself, but spoiler alert, that does not work for us. So yeah, I ended up really burned out with lots of health issues. Don't ignore your sensory needs because you won't grow out of them. But yeah, I had really bad anxiety and exhaustion. I used to get home from a day in the clinic and just pass out on my couch. I couldn't really function or look after myself. And then the alarm would go off the next morning. I'd feel like death, but I'd force myself to do it all again. And then I started getting sick more and more until I was forced to take some days off. But yeah, the dental environment is difficult. When you have sensory processing differences, I just didn't know at the time. And after I had to stop working, I ended up with glandular fever, and burnout was so bad. I had like that skill regression thing that people talk about on TikTok. I couldn't mask. I just had no energy, and I was really anxious because all these traits were coming out. I didn't have control over it anymore. Yeah, I could barely brush my own teeth, let alone other people's. So when that happened, I went to see this therapist who said, why don't you try some sensory accommodations? And I kind of laughed. I was like, I'm a dentist. I think I'd know if I had sensory issues. And she's like, just try them as an experiment. And from that point on, I was a new person. So
can you explain what those are for the uninitiated?
Yeah. I mean, look, I finally have overcome my burnout. It took 2 to 3 years, if I'm honest. But these days I do have a way of managing it. And the main one is honestly that I'll probably never work full time as a clinician.
Right.
That it's just not sustainable for me. I can handle like 2 full days a week, and then I need 2 rest to regulation days. But when I am in clinic, I wear my earplugs. So I've got those like Loop ones. Loop is not sponsoring me, but I would happily take one. And I also schedule breaks between my patients where I can fidget, put on noise cancelling headphones, use other regulation strategies that I've learnt in therapy. I also work a lot more slowly than I used to. I don't try to do like 7 fillings in one appointment. I try to minimize my exposure to all the sensory stuff.
Yeah.
And speaking of smells, one thing I'm very proud of is that when I combine my sensory sensitivities with my pattern recognition skills, it can be very useful. So I'm certain that I can smell gum disease.
Oh.
Wow.
Like I don't have any way to back this up with evidence, but
oh, I don't care. I believe you. That's so cool.
I haven't been wrong once. So I smell it and I'm like, okay, I'm going to do diagnostic tests. And every time I'm right, but gum disease.
What's it smell like?
Oh, I can't explain it. It's just very specific and it's different.
Oh,
I think if I explain it, it will get a bit gross. So
okay.
Fair enough. Oh my God. That is so cool though. My mum has a ridiculously intense smell sensory thing. And like, she came out one day and was like, I can smell this. I can diagnose. I wouldn't even be shocked. So I absolutely believe you because my mum can smell like BO in a supermarket 4 aisles away, and she's like, we can't go any further. We have to wait.
Like one of those airport sniffer dogs.
Yeah, absolutely.
Yeah, I think I'm lucky in that regard. Like when I did have my full test done and all the sensory stuff, I'm definitely very sensitive to visual and auditory things, but I think I'm a little bit undersensitive to smell.
That's interesting because, like, I mean, aside from smells and whatnot, the dentist is kind of like the place where you're working. It's kind of quite well lit, and there's the noise of drills and stuff like that.
So noisy.
Yeah.
Yes. Yeah, it's definitely not ideal. If I'd known what I know now, I'm not sure I would have gone down that path. But saying that, I am glad that I'm here now and I'm doing some cool stuff with it. Hopefully I will gain enough clinical skills to really understand it, like really be able to get inside it. But then eventually I want to transition into some new exciting ideas.
Excellent.
That's very cool.
Wonderful. Well, we're going to have a quick break, and when we come back, we're going to talk more to Romi about dentistry, neuroaffirming practices, and etc. See you in a moment. What do you do when you don't have ad copy to read out for a relevant to this episode product, but you really want to hype that product regardless? Well, I'll tell you what, you advertise an episode of your own podcast where that product was the focus, of course. Is it weird and self-indulgent to plug your own podcast on that podcast? I don't know. Sure, let's say yes. But if you want to hear some more testimonies from Jacinta and I, alongside Romi's, about loop earplugs, why not give our noise sensitivity episode a listen? It's one of our earlier ones. You can find it on any podcast service, including the one that you're listening to this one on now. And it's a bit bloody spectacular. Now, the promo code that we give out in that episode is by now out of date, but I still think it's well worth your time and money to check out Loop's range for yourself and create a calmer, more manageable auditory experience for yourself.
Amazing. I hope you had a nice little cup of tea, nice little relax in our very quick little break. And we're here with Romi Fried. Romi, darling, what in dentistry is not neuroaffirming in terms of, we've already touched on how it sucks for, neurodivergent dentists, but how is it overall for, staff and patients and as a practice?
Yeah.
Big question. Go for it. What's wrong?
Big question. Just like society, like we have a long way to go when it comes to adopting a more neuroaffirming paradigm. And dentistry is no different. Unfortunately, it's only fairly recently that the old school like medical models of illness and disability are starting to come under critique. And in mainstream spaces, like in the healthcare system, it's all very much run by evidence, and research is usually at least a decade behind what we're seeing kind of clinically and in society. So we've got this slight move towards the social model of disability, but it's also largely still unheard of. And this has an impact on everything, like from the top down. So the systems that are in place for dentists and staff to work within, which impacts the care we can provide for our patients. In my opinion, the biggest two limitations with regards to neuroaffirming care in dentistry are clinician education and financial constraints. So providing neuroaffirming care requires clinicians to really understand the concept of neurodiversity as well as how to support different neurotypes.
Yeah.
And this relies on a baseline understanding of disability and accessibility, which is not something that's really covered in any depth during dental school.
Right.
Yeah.
So education's a huge barrier because it has a ripple effect on everyone involved in patient care. And dentistry is also a very expensive industry. Like the equipment and the supplies, they're pretty much all privatized and they're very expensive. So most practices are under a lot of pressure to see enough patients in order to cover their expenses and paying staff. And even in government, like I'm working in non-for-profit community health, but there's a certain level of productivity expected in order to still qualify for funding and increase funding to community clinics. Yeah. So it's tricky because productivity isn't being defined by patient satisfaction or preventative care. It's being measured. It's being measured by like how many procedures have you completed, how many patients have you seen, and this is a huge issue when it comes to providing accessible care because accessibility takes longer and it doesn't necessarily generate the same KPIs.
Yeah.
Sure. So, I mean, you already said the things that need to change, but are there any sort of like actionable things that can be done at this stage that could change the dentistry industry to make it more neuroaffirming? Are there things that are being done currently?
Yeah, I mean, I certainly hope to generate some change in the dental industry by starting conversations like this one. And my plan is to develop some resources and workshops for educating clinicians in the oral health industry to learn all about neuroaffirming practice. And there are some very important and large shifts required in the long term, but there's also a lot of little things that we can do as healthcare workers to improve accessibility that don't really cost us anything. Patients don't need to have a formal diagnosis or even disclose in order to have sensory needs met. Like we can provide them with a simple questionnaire in the waiting room and different options. For example, many of my patients prefer to wear noise-cancelling headphones during noisy procedures, but they wouldn't think to ask unless I offer. So it's things like that. And a lot of my patients, if I offer them a fidget toy, they're more at ease, but they don't think to bring one themselves. So it's just having those extra measures in place. Even I'll give my patients the option sometimes, like, do you want me to give you like a live detailed explanation of what's going on so that you can feel like you're in control? And other patients I give the option of, I mean, I give both options, but other patients will choose the option of like, I only want to know what I need to know for informed consent and then don't tell me any details.
Yeah, right.
So it's about what makes people feel comfortable. Yeah, I think that it mainly comes down to acknowledging that everyone has a different brain and different nervous system. It's not one size fits all, even though the textbook might make you think that. And as a dental industry, I think as we move towards improved accessibility, it is happening. Like where I'm working now in non-for-profit, I'm seeing incredible shifts and we're already seeing amazing outcomes. Like you start to reach populations that just weren't receiving any oral health care before.
Yeah.
You can prevent people from losing their teeth prematurely. And, even beyond just needing your teeth to eat and talk, it's a huge impact on people's self-esteem, their ability to get a job, socialize. But also when you avoid going to the dentist, you end up with pain, infection. Some people end up hospitalized. It can even be life-threatening. So moving towards accessibility will have a huge ripple effect. Like we want to also reduce the number of general anesthesia procedures required because a lot of neurodivergent people who can't sit in the dental chair will be having a general anesthetic every year or two in order to get their dental work done. And that's just not sustainable.
Wow.
So they're all my main reasons. And for those kind of business-minded folk who are driven by profitability, I think that this is an untapped market. Like there are so many people who don't currently access dental care but want to. And I mean, I don't know a lot about economics, but it seems like supply and demand or something like that.
Guess what? Neither do we. It's all good.
Yeah, but like any paradigm shift, I think there's going to be a lot of resistance because people don't like change, but we're headed this way already. So you can either get on board or get out of the way.
Like, absolutely. And there's so many things that, much like other industries, other areas, accessibility doesn't just help neurodivergent people or disabled people. Like, absolutely. I reckon you're tired, you're having a tough day, you have to go to the dentist. Anyone's going to think, yeah, great, put some noise cancelling headphones on me. Do you know what I mean? Like, it's not just like that's customer care and customer satisfaction all round, in my opinion. And you're absolutely right. I go to the dentist every 6 weeks. I have braces. I actually don't mind it. I'm really quite lucky where I've had a lot of really positive dental experiences. So I have a kit that I take with me, essentially, because I never considered like maybe they'd have headphones. So I pack my loops every time and I pack a fidget toy every time, and they know that I'm potentially going to play on my phone. And that's just someone who genuinely doesn't mind the dentist. Like I used to fall asleep in the dental chair kind of thing.
Amazing.
And, you know, I recognize that I've been really, really lucky in all of my dentists and orthodontists and specialists have been super communicative, which I didn't realize I needed until I saw one person who wasn't and didn't explain everything.
Yeah.
And I was like, oh, okay, so I do need to know what's going on from a curiosity perspective, because I'm just super intrigued because I have no idea how my mouth works and I have so many weird things going on in there. But also from a what are you looking at now? What are you doing? What's going on kind of perspective. So, you know, and it never took that much longer for my dentist to explain what she was doing. Like she's always on time. To be fair, I think she does have a chaos demon herself now that I'm thinking about it.
It's common actually in the dental sphere.
But she would just explain it while she was doing it. She didn't need to take any extra time or anything, and it meant that we were chatting rather than me just sitting there being awkward kind of thing. So I think you're absolutely right. There's a lot of, you know, even though it's going to take a long time to make system change and institutional change, there's a lot of things that independent practices can be doing that absolutely would tap into an untapped market. Because if I struggled with going to the dentist in the same way that I struggle with like my personal care at home, I wouldn't go.
Yeah.
Like I can definitely understand why people don't go. And I just got lucky where for some reason it's different. And my pain threshold in my mouth is apparently like 50 bajillion times better than anywhere else on my body. Yeah, it's fun. My dentist is always like, tell me if I'm hurting, to the point where now she'll get people to come in and like push and show that it doesn't hurt. It's really weird. She really enjoys it. Like anytime we've had she did a 3D imaging scan thing where they had to shove that weird torchy thing in my mouth. And the friend who she got to come and do it was constantly like, oh, are you okay? Tell me if it hurts. And Cecilia was just like, Jacinta's fine. She like barely feels things. And I'm like, yeah, that's right. But like, you give me a paper cut and I'm going to like absolutely cry. But in my mouth, things are totally different.
I believe I believe that's the professional term for it too, right, Romy? The weird torchy thing? Yeah.
The thingy is the term I use a lot.
Obviously. But no, like you already have to do the bibs and the funky glasses. It's not that hard to throw in, you know, loops or headphones or something into the mix. You know, it's not that hard to have a fidgety thing there. And you're right. We're so used to not having these things available to us. No one's going to ask. Like, unless there is a questionnaire, like you were saying, that has like your preferences or something, maybe on intake or, you know, just to check in when you come in. And like, they don't take much extra time. It's stuff that you're already semi doing. It's just one minor extra step.
Yeah, and even like, you know, if money is an issue, I can see a world where, like, I know this already exists. There are some dentists who give patients options for a longer appointment, and it is slightly more expensive, but there are lots of people who would want that. Like there are lots of people who would say, I'm willing to pay a bit extra to not feel rushed because I want to have all my questions answered and I want to be able to understand everything that's going on. And I think people deserve to have that option. Like I definitely benefit from that. And some people don't, and that's fine. Like you can do the fast version for those people.
Yeah, but having the option, the same way that a doctor has a shorter consult or a longer consult. Like
it's kind of amazing how many of these things just in like all sectors of society come down to open communication and giving people a choice to do a thing, you know?
Pretty much.
It's quite interesting. Like every person that we've talked to on the podcast who have been involved in enacting some sort of change in an industry, it's kind of always come down to listen to what people are saying and then give them an option, you know? And it's not rocket science. It's not dental surgery.
Nice.
And it's this obsession, I think, that we have in, you know, mainstream, like corporate culture, especially with efficiency and everything coming down to like the numbers and the productivity. But like there's still humans on the other side of things. And one of the things that, you know, a lot of people don't think about, and especially a lot of dentists don't think about, is that the mouth specifically is so vulnerable for people. Like, you're opening your mouth, you can't see inside there.
Yeah.
You can't talk. And for a lot of people who've experienced any kind of trauma, it's quite scary. It's quite triggering. And most neurodivergent people have experienced some trauma. Like, just a bit.
Just some, occasionally, a sprinkle.
So I think, like, it's about really seeing that there's a human being there, and it's not just one of those robot dummy things that we practice on in dental school. Like, there's a person there with feelings.
Yeah. And I think that goes back further as well in terms of you guys, the staff, the dentists, the dental nurses, all of that. You aren't robots either. And the fact that there's so many KPIs and pressures put on you guys is just so insane that, of course, it's going to have a flow-on effect. So not only is there the education around, you know, patient care, but also, like, your staff care.
Yeah.
Because that's just so insane that you guys are measured on how many people you get in and out when, you know, it's so widely proven that preventative care for so many things is the best way to go. Because absolutely, the people I know, neurodivergent or neurotypical, generally don't go to the dentist unless they have to, kind of thing. Like, it's not preventative for a lot of the people that I know, you know, unless they're lucky enough to have private health insurance, and then it's essentially, oh, well, I've already paid for this.
Yeah, it's hugely inaccessible for most people, and so it makes sense that most people don't want to go. Totally. Yeah. I'm trying to figure out a way at the moment, and I don't have all the answers yet, but I'm trying to figure out how we can make preventative care more profitable in terms of selling it to, like, funding bodies and business investors and all those fancy terms. Yeah. I think there's a way to do it. Like, I don't think that looking after people's health and keeping the economy alive need to be mutually exclusive, but we'll see.
Absolutely. Are there any resources that you know of that people can access if they want to learn more about neuroaffirming dentistry or what they can be doing, whether it's from the patient side or the dentist side? I don't know how many dentists we actually have in our differently brained community. I'd gamble it's you.
I think there's a lot of closeted ones. Yeah, I mean, to my knowledge, there isn't a lot out there in this specific area yet, and I probably need to get around to actually uploading a bunch of posts that I've got sitting in drafts. We'll get to that at some point. But keep following my page, because there will be some posts at some point. And I can also highly recommend Dr. Trudy Lin, who is a specialist in special needs dentistry. If you look her up on, like, YouTube or Spotify, she talks about all this incredible work she's doing in advocacy and accessibility. I can probably also send you a list of fabulous Instagram accounts who do neuroaffirming, like, oral health. There's a few out there. And
that would be wonderful.
Yeah. And then finally, I'd say I have to give a big plug to the wonderful Sandhya Menon, who is a psychologist and is ahead of the game in the neuroaffirming space. Like, her work has changed so many lives already, and I work with her and help facilitate some of her affirming practice workshops, which have been a huge inspiration for me, just seeing that it is possible, like, and there are lots of clinicians out there who want to learn.
Yeah.
We had one in Melbourne. We've been to Sydney, Brisbane. We've got another one in Melbourne and then in Perth. So there's demand for this. But my number one recommendation for people who want to learn about neuroaffirming dentistry is just be curious, like, question what you already know, especially if you're learning from medical textbooks and lectures in the old school model. Be ready for nuance and diversity in your knowledge. Just because it wasn't taught to you or examined, you know, it doesn't mean that it's not really important. And learning about neurodiversity just as much as you possibly can, like, even understanding your own neurotype. You don't have to fit diagnostic criteria to have your own specific quirks and sensory preferences.
Yeah.
The more we're curious, we can extend empathy and understanding to people who experience the world differently to us.
Beautiful.
I love that. That was so beautiful. Oh my God. Lachlan, do you want our last question,
Yeah, I want the last
as you like to do?
Yes. So the last question that we've got for you is the one that I enjoy asking the most. Do you have any good representations of ADHD individuals in any form of media, books, film, television, whatever? Bonus points if there are any dentists, ADHD dentists in those spaces. But yeah, like just anything that might have resonated with you.
Yeah, I love this question. I mean, one of my special interests has always been TV shows, and at the moment, it's like very filtered through finding neurodivergent coded characters. So there's a lot. It's really fun. I mean, any show that's written by a neurodivergent like showrunner, most of the characters are coded that way. Like Community definitely is. And when I'm thinking of a dentist example, I reckon my favorite one would be Lincoln from Broad City.
Okay.
He is a dentist. He has a blog called The Al Dente Dentist where he reviews pasta.
I love that.
And he's definitely presented as like one of the more neurotypical characters in the show's universe. But he's dating Alana, so like, come on, who's he kidding? I reckon he's dating her because she's just modeling to him how to unmask his own ADHD.
I absolutely didn't expect a dental example, and I'm so impressed. So impressed.
Oh, and definitely have to plug one of my favorite shows, which is Always Sunny in Philadelphia, which is not the most politically correct at all times, but so ADHD coded.
Yeah. Absolutely. I do enjoy that for anyone who wants to see the evolution of characters who are actually probably like pretty despicable people. But at the same time, like they've evolved over time, over 15 years. Watch It's Always Sunny in Philadelphia.
It's so good.
That was amazing. I actually have one final question before I let you go.
Yeah.
Is House neurodivergent coded, yes or no?
Oh, yeah, House is autistic.
Just got to check, I'm thinking, Lachlan, that we're going to do a full episode on this when I've finished, but I needed Romi's opinion. Yeah, good.
Yeah, I mean, this isn't my professional opinion for legal reasons, but
don't worry, we have a disclaimer at the end.
Yeah, I reckon House is pretty autistic.
I vibe it. I just watched the episode where he treats the autistic kid and the kid gives him his, I don't know, that gaming console at the end. And I'm like, yeah
exactly. Also, the show is written by a guy who wrote, what's that show that everyone watches? The Good Doctor.
Oh, right.
Yeah, it's the exact same formula. Like I watched one episode of The Good Doctor and I was like, I actually can't watch this because it's identical in the formula to a House episode.
I had no idea. Okay, very good to know. Thank you. I just needed that, on the record. Not medical opinion, just speculation. I needed the House expert. Amazing. Thank you so much for coming on today and teaching us so much about dentistry and things like that. You're now going to get all of my dental questions, just like...
Oh, I can't wait.
Yeah.
Send me pictures.
Oh my God, you're so nice. We will link in the show notes to all of Romi's stuff, as well as all of the links that she sends through to us if you want to find more neuroaffirming dental information and all of the wonderful people that she mentioned. But thank you so much for being here.
Thank you.
All right. Goodbye.
I was going to say, Lachlan, you didn't say your bye like you normally do.
Oh, bye. Differently Brained shares the opinions of individuals and does not consider your personal circumstances. Differently Brained exists purely for information purposes and should not be relied on as health or medical advice. Because no brain is the same, please consult your healthcare professional for your personal medical needs.